All right, we're here with Dr. Beck, who does working with the nerves and does nerves tests and all kinds of stuff, but also uses physical therapy to help people. Now, I know people are sometimes, Dr. Beck, have a question about physical therapy. What does it really do? Does it really help sometimes avoid surgery? And if so, which ones and when and at what stage? Can you tell us a little bit about it?
Yes, I can. In addition to doing nerve testing, I see a lot of people with muscle and joint complaints, sore muscles, sore joints, injuries to the muscles and joints, and also people with a lot of back pain. And frequently when they go to the doctor, say a surgeon or orthopedic doctor, the first thing the doctors start talking about is surgery, injections, really invasive type of procedures. And so people frequently come to see me, and the first question they have is there anything I can do to avoid surgery or injections and things that's been recommended to them by their previous doctors? And the answer to that is yes, and it's physical therapy. And physical therapy can help a lot of different conditions. For example, any type of shoulder strain that doesn't involve major disruption of the shoulder joint can often respond very nicely to physical therapy. Back complaints respond beautifully to therapeutic exercise, and frequently surgery such as fusions, disc problems can really be totally remedied by a course of physical therapy. Other conditions are sports conditions. You pull a hamstring, you strain an ankle. Things like this can all be really helped by physical therapy, which is safe, it's effective, and it doesn't involve getting cut open or getting a needle stuck into you. So it's a very safe and effective procedure. Now, what happens with physical therapy is people will come in, they'll get an evaluation by our physical therapist, and then they'll set up a treatment plan. And frequently treatment involves 2 to 3 times a week or 2 to 3 sessions a week of therapy, and that usually lasts for 4 to 6 weeks, at which time people will usually go home and continue on their own with a home exercise program. But normally after 2 to 3 weeks of physical therapy, people are really doing a lot better and feeling a lot better as well.
Well, sorry, I just had to sneeze here. And I tried to make this sneeze a quiet one so it doesn't blow you away on the other side. So basically what you're saying is, short of course, a shoulder being completely broken or dislocated where, surgery might have to totally happen or other body, but you're saying a physical therapy, which is, somewhere along the line exercising and moving the body part, it definitely very often remedies the situation. And I think the nice thing about this, and let me tell you what the time frame there is that one sees one is going in the right direction, so one doesn't have to do it for, let's say, 20 years and then say, well, it didn't work. What are we talking about here? That because avoiding surgery, nothing against the surgeons as such, but it is with no doubt a common understanding that if you can stay away from the knife, you do, because there are many other complications. The body is traumatized. The body didn't get born with the deficiency of a cut in there somewhere, or with, so if you can fix it naturally where the body heals itself, that'd be a great thing. So even if it doesn't work, all you have lost is a little bit of, physical therapy, and then you can still always go for the surgery, I suppose, right?
Well, that's right. And in fact, many surgeons will recommend therapy before they even consider surgery. Now, obviously, there's some conditions that's going to require surgery, like you mentioned, broken bones, ruptured tendons, things like that. They're not going to get fixed with physical therapy. But for the conditions that will respond to therapy, typically people should start to see improvement within about 2 weeks. Now, I tell people when you start therapy, you're going to be a little bit sore. You may have a little bit more pain for the first week or so, but after about 6 to 8 sessions of physical therapy, you should start feeling better. And a typical course of physical therapy usually goes about 4 to 6 weeks, occasionally 8 weeks. But so, you're out a month or so of time for about an hour 3 times a week. So it's not a huge investment in time, and it can really pay off.
Wonderful. And so definitely it's something I think anybody can recommend, and people should know about it, that they should really explore that first, and for all purpose, the way I look at it, even drag it out, not like say, all right, I see what it does in 6 weeks. Just go in and say, I can fix it with it. And if it takes 2 or 3 months, if it bites a little later, let's do it. Because again, 2 or 3 months later, surgery usually with those type of things isn't life-threatening, and yet you really explored it. Wonderful. Well, thanks a lot, Dr. Beck. Thanks a lot.
Okay.